Liquid rhinoplasty. This video is a recap video and is not official training. Please make sure that before viewing this video that you have attended an in-class course and you feel confident and happy with the training that you have received. Staying safe when injecting. Liquid rhinoplasty is seen as being a high-risk area, and a few points that we need to take into consideration when injecting to keep that client safe are as follows. Number one, know your anatomy and understand that everyone's anatomy is different. Know where your blood vessels are around the area in which you are injecting, and know the way in which the blood tracks through those vessels. Knowing where your lateral nasal artery is, your angular artery is, your supratrochlear artery is going to help you to identify any problems during the injection process. Number two, capillary refill is very important. By being able to check a capillary refill before even treating the client is going to allow us to understand that individual's client's refill and the amount of time it takes for the blood to rush back into those vessels when depressed. Also, during the treatment, it's very important to keep maintaining and keep carrying out capillary refills to check the safety within that treatment. And after treatment, always check the capillary refill after treatment so we can see that it matches up with how that client presented prior to the treatment, or even if the capillary refill is a little bit quicker, that is perfectly fine. Inject on bone where possible. So by injecting on bone, it is seen as being one of the safer places to inject, as you are bypassing any major vessels by injecting down onto the bone area. However, it is never foolproof, and we always have to take into consideration other aspects like capillary compression rather than full occlusion, which could occur when injecting on bone. Inject the filler slowly. By injecting the filler slowly, you are not pushing and rushing filler to the area, which could cause compression to major vessels. By injecting that slowly, the filler has time to be able to settle within those tissues and spread properly within the tissues. Inject small amounts of filler at a time. So by injecting small amounts of filler at a time, you are able to make small changes, especially to the nose, and you're able to make those changes safely. You will see when it comes to the videos that we will be injecting little bits at a time. One, it's going to make sure that client is safe and there's not too much filler in an area, and we can maintain and monitor the safety aspect as well. Stay on the midline where possible. By staying on the midline, it's one of the safest places to inject. If you think about your anatomy of the nose, usually, in most cases, the vessels run alongside the nose area. By staying on the midline, you are less likely to inject onto or into any vessels. However, this is not 100% foolproof. When carrying out linear injections on the nasal area, so for example, when you might be lifting a tip of the nose, always inject retrograde. That means that when we come and we pull back out of the skin, we are injecting. We are not pushing filler and pushing our plunger down as we're pushing into the skin. It's really important that we always inject filler on the outward stroke of coming out of the body. Aspirate for at least 10 seconds on the nose area. Carrying out a longer aspiration and taking that into consideration, and that into consideration when thinking about client care, is really important. A positive aspiration can present after 8 or 9 seconds in some cases on a rhinoplasty. So it's important that we maintain that safety to ensure that we have not injected directly into any major vessels. Assess the total volume used when injecting. As we know, firmer filler can really lead more so to compression. So always think about the volume you're using and about the type of filler that you're using and the cross-linking within that filler. Keep an emergency kit to hand at all times. So especially when injecting any type of filler, we should always have hyaluronidase on site. Especially when injecting noses, we need to have hyaluronidase and a couple of vials of it, because we may need to flood the area if we find that a complication has occurred. Keep your emergency kit at hand. Have your hyaluronidase, your bacteriostatic water, your selection of needles and insulin needles, as well as aspirins to thin the blood also. Ensure you advise your clients of knowing who to contact and at what point to contact after you have completed the treatment if a complication has been spotted. It's always good and it's really important to educate your clients in a nice way, a non-scary way, so they know as well that if they do see something abnormal, or if there's something not quite right, they don't have that fear to contact you, and they'll be able to contact you so it can be dealt with in a professional way. And that's part of giving appropriate aftercare advice. Within aftercare advice, we should all have a sheet of paper or a leaflet that we can hand out to our clients, giving them information in a nice way about what to look out for if a complication does present. So thinking about mottling of the area, severe pain, cold to touch area, and the difference between a possible occlusion and what a bruise looks like. This is going to allow you to be able to give a much safer treatment, and it's also allowing us to have that duty of care towards our clients also. When injecting on to the midline on the dorsal area of the nose, always inject small increments in a bolus to the bone. Make sure that your bevel of your needle is either upwards facing towards the forehead or down facing towards the tip of the nose. If you face the bevel towards the side, you are putting that client more at risk of compression or occlusion, plus you can make filler overspill, so be off the centre line and the nose won't look atomically correct. We will be placing small amounts of filler and we will just be building the nose up. A small change or a small bit of filler can result in quite a dramatic change to the nose, so always build up. Always have your needle perpendicular. If you looked at that needle from the head of the bed, you will see that it's perfectly straight. It's not slanted to the side. If you slant that needle to the side, obviously your clients would be more at risk of possible contractions. We will also pinch the nose to allow for the filler to maintain its position within the midline of the nose also. This is a great technique for filling out indented areas to level it up with any dorsal hump which could be present on the nose area. Once you've placed the filler, you can always massage it as well. So if you need to massage it and slightly mould it into place, you can do so. This technique is great for lifting the tip or creating a pixie tip lift. First of all, we inject into the septum, making sure that your bevel is facing down. This technique is going to be a bolus into the septal hollow and then come out on a linear. This is allowing a foundation to be put in place to hold the tip lift. And we'd place that bolus after we have aspirated for our 10 seconds, and then we would come out on a linear which will extend the septum from the nose. After we've completed that injection technique, we're going to lift the tip. Firstly, we're going to come into the tip from the underside of the nose, and we're going to place the nose on top of the needle with the bevel facing upwards. We want the needle tip to finish at the apex of the nose, and so you can see a little bit of blanching at the top also. This allows for safer injection techniques when injecting into cartilage. And here we are going to be definitely aspirating for our long period of time, so for our 10-second period of time. Because it's in cartilage and we're not going directly onto bone, this can be a little bit more risky, especially with those lateral nasal arteries which cross over the just at the top of where we're injecting. With this, to create a pixie tip, we're going to leave a small little bolus, and then we're going to come out on a linear injection, so retrograde, and we're going to come out, and as we're coming out, we're going to slightly lift the nose upwards to allow for an elevation. Our second injection technique for the tip is absolutely amazing, and it's a technique in which we go into the nose in the opposite direction. So we're injecting from the apex down into the underside of the nose, and this injection technique is leaving a linear injection, and we will come out of the nose in a retrograde fashion. Again, we're going to be injecting into cartilage, so we must make sure we're doing full aspirations, checking capillary refills as we normally would do so. And as we come out on this technique, this is going to give an automatic lift to the nose. So the direction you pull out on that linear is the direction in which your lift is going to occur. And as we come out, we're going to place our finger on the underside of the septum, and as we come out on that linear, we're going to lift that nose with the needle retracting out of the cartilage area. This gives a fantastic lift, which you'll see. Amazing. Always keep checking the nose area out also to see if you need to make any tweaks. This next injection technique, which is commonly done after the tip lift that you have just seen, is a technique in which we can level out any indentation between the tip and the dorsal hump. And this is a surface-based injection, bevel facing upwards, going across the area in which we could have an indentation in a linear fashion. always aspirate. Again, this is seen as a little bit more dangerous because obviously it's going in the region of where that lateral nasal artery is. But as long as we can see that blanching, we should be generally safe, but it's never 100% foolproof. So full capillary refill checks, full aspirations should be occurring. Make sure after you have done your liquid rhinoplasty that you go in and you can mould the nose by massaging it and pulling it upwards also. Just making some tweaks here, so just making a tweak on an area of indentation just above the dorsal hump. So making sure that I am completely perpendicular, the bevel's facing upwards towards the forehead, and placing a small bolus to fill out that area of depression. Make sure you're injecting slowly and using small amounts at all times. Always keep the tip of your needle steady, because if you move after you've aspirated, you could have moved the tip into a vessel and the aspiration would be null and void that you have just applied. You will see a before and after of this lady at the end of this video. This clip shows a positive aspiration, and this shows you quite clearly how to not panic, and it shows you how quick a positive aspiration can occur. So you can see that I'm on the midline and that I'm going down to bone. However, you can see that the blood is filling up into the needle chamber. I'm not pressing any product in. I've completely taken the needle out and kept that client safe. These are some liquid rhinoplasties that have been performed at Little Beauty Academy by trainers and trainees.